March is Colon Cancer Awareness Month, and doctors really want to make sure that you're getting this screening that could really save your life. Carolyn Bruck now has a look at the importance of getting a colonoscopy.
March is Colorectal Cancer Awareness Month, and getting a colonoscopy is one of the most common ways to test for colon cancer. And that kind of screening can catch cancer before it starts. But so many people dread the prep. But fear not, experts say there are options.
We have many new kids on the block that are better tasting and more palatable and much lower volume that patients are really appreciative to have.
Dr. Carol Burke of the Cleveland Clinic says the solution you drink before a colonoscopy is designed to clean the colon. It allows doctors to detect and remove polyps more easily and in turn prevent colon cancer. If you're nervous about the solution, talk to your doctor because there are different options. In addition to the variety of volumes available, which vary from 1 liter to a gallon, there are different flavors too. One type comes with different flavors for each dose to prevent flavor fatigue. Another has small individual bottles. Dr. Burke says the colonoscopy prep solution may not need to be chugged all at once either. In some cases, doctors will recommend drinking half of the solution the night before the procedure and the other half the morning of. In addition to the solution, a liquid diet is recommended the day before your colonoscopy, but be careful what you drink. Dr. Burke says it's a myth that all liquids are fair game.
You really should be on only clear liquids the day before the exam. Lots of clear liquids. Some people are confused about what is a clear liquid. A clear liquid is any liquid that you can put the newspaper or magazine behind and see through. So orange juice with pulp, not a clear liquid.
The colonoscopy procedure is recommended for most people beginning at the age of 50. Carolyn Bruck, NBC Charlotte.